In this video tutorial, I am going to discuss lactate dehydrogenase or LDH and when it should be measured so it actually makes sense in clinical practice. The answer might surprise you. Before we dive in, let me give you some context. LDH is an enzyme that lives inside the cells. So suppose this is the cell and this is LDH inside the cell. It's found in almost every tissue in the body: heart, liver, muscle, kidneys, red blood cells. You just name it and LDH is present there. Now, here is the crazy part. Normal serum LDH activity is only 125 to 220 units per liter. But inside the cells, LDH levels are 1500 to 5000 times higher or greater than the serum. Because of this massive intracellular to serum concentration gradient, even minor tissue damage can lead to significantly elevated serum LDH levels. So that means serum LDH level is very sensitive. So if it's so sensitive, why don't we use it for everything? Well, here is the problem. And this is super important. Because LDH is found everywhere and elevated level doesn't tell us which tissue is damaged. Heart problem, liver disease, muscle injury, or something else. High LDH alone can't tell us the difference. It's what we call non-specific. Now, LDH actually comes in 5 different forms called isoenzymes. Each tissue has its own pattern. For example, the heart has more LDH1 while the liver has more LDH4 and LDH5. So theoretically, if we measure these isoenzymes, we could figure out which organ is damaged. Sounds perfect, right? But there are two big problems. First, we now have better and cheaper tests for heart and liver disease. So currently, these disorders are not diagnosed by LDH isoenzymes. Rather, Troponin is used for heart attack and alanine transaminase along with aspartate transaminase are used for diagnosing liver problems. These are way more reliable tests. So for cardiac and liver conditions, LDH has been basically retired. And the second problem is that most laboratories don't even do LDH isoenzyme testing. Remember, serum LDH level is done by all the labs, but not its isoenzymes. So question arises, is measuring LDH completely useless? The answer is absolutely not. There are two areas where LDH is still incredibly useful, and these are hematology and oncology. Let's talk about them one by one. So let's start with hematology applications, or you can say blood disorders. LDH1 and LDH2 are found in red blood cells and other blood cells. So when these cells break, LDH spills into the bloodstream. For example, take hemolytic anemia. This is when red blood cells are destroyed faster than the normal. Serum LDH shoots up significantly, and this increased serum LDH level, we use it for diagnosis and to monitor how severe the condition is. Then there is a megaloblastic anemia. In this condition, immature red blood cells break down right inside the bone marrow even before they are released. This dumps a massive amount of LDH into the blood. And so serum LDH level reaches up to 50 times of normal level. LDH is also crucial in blood cancers like leukemia, Hodgkin's and non-Hodgkin's lymphoma, and multiple myeloma. Higher LDH levels are linked to decreased survival rates. So we use it to monitor disease progression and response to treatment in case of these blood cancers. Means if after treatment serum LDH level is decreased, then it's considered a good sign, or you can say treatment was effective. So here it's not used for diagnosis of these mentioned blood cancers. Rather, it's used for monitoring of disease and treatment purpose. Now let's talk about solid tumors. When cancer spreads to other part of the body, what we call metastasis, LDH level increases. It's a red flag that the cancer is advancing. This is especially true for cancers like melanoma, kidney cancer, lung cancer, osteosarcoma, and prostate cancer. In these cases, an elevated LDH almost always signals a poor outcome. Alright, before we wrap up, there is one weird phenomena I need to tell you about. It's called Macro-LDH. What is Macro-LDH? When normal LDH, suppose this circle represents LDH, binds to its own antibodies. Suppose these Y-shaped molecules are antibodies. This big complex is formed and it is called as Macro-LDH. It is seen in about 1 in 10,000 people. Now, it doesn't cause any harm to the body, but here is the problem. It causes persistently high serum LDH level. The patient has no disease, but the labs keeps showing elevated LDH. This leads to a cascade of unnecessary tests like CT scans, biopsies, specialist visit to rule out hematological, oncological or other problems. If someone has constantly or consistently high LDH with no clear cause, macro LDH should be suspected. The only way to confirm it is through electrophoresis, which shows an extra LDH band. But good luck finding a lab that actually does this test. So let's summarize. LDH is highly sensitive marker, but because it's everywhere in the body, total LDH alone doesn't tell us much. For heart and liver disease, we have better tests now. So LDH is not used for diagnosing heart and liver diseases. But in hematology, especially hemolytic anemia, megaloblastic anemia, and blood cancers, LDH is still considered as a gold. And in oncology, it helps track metastasis and prognosis in solid tumor. And if you ever see persistently high LDH with no explanation, think about macro LDH. Rare but worth knowing. So that's it for this tutorial. I hope everything is clear now. If you have any doubts or questions, drop them in the comments below. I will see you in the next one. Thank you.